Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
It is Saturday morning, it's 9 o'clock, and you know what happens on VOB every Saturday at 9?
What's happened, boy?
It's time for 15 sugar-free minutes with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Good morning to Larry. Good morning to all you wonderful sugar-free people tuning to VOB right now. This is Peter here. I understand that there's some people who listen to this show who will still put sugar in the tea. But we can let it pass, at least for now, because we still want you to hear the messages which will encourage you to help reduce that sugar intake and also to help you to manage your diabetes. And if you don't have diabetes, to help you to keep not having it. All with the compliments of the Maria Holder Diabetes Center. We have so much things on this program this morning. So much health information that you're going to want to hear. So if you are planning to leave home, cancel it. If you are about to go through the door to go to church and get married, but you can't get a place no more, call the people at the church and tell them,
The wedding per hole, but my health more important.
because you need to listen to this show. So let's get started. We are going to go straight to diabetes specialist nurse Tracy Bushell, and she is going to be speaking on a very important topic. The importance of ensuring that you obtain key education to assist with managing diabetes. Some real interesting points in this one. Let's take a listen.
Being diagnosed with diabetes can be quite a shock and creates a huge change in a person's day-to-day life. When change happens, we generally plan for it, but a diagnosis of diabetes happens in seconds and can leave you feeling overwhelmed and even with feelings of isolation. At diagnosis, knowing and understanding what has changed in your body really helps to understand the reasons for certain things that you will be advised to do or change by your healthcare provider. These changes are usually related to diet, exercise and activity, being prescribed medication, specific tests and education programs. Education is the cornerstone of managing diabetes and leads to self-management skills for an individual. It will enable a person to keep their blood glucose levels near to normal, understand the numbers and targets for those specific tests, thus reducing the risks of long-term complications associated with diabetes. Ensure to engage with your healthcare provider and agree goals that are achievable and not overwhelming, and then build on that information going forward. My role as a diabetes specialist nurse at the Diabetes Center is all about education. I will share all the relevant information and tools to enable persons to self-manage their diabetes and of course address concerns and questions. It is important not to be overwhelmed with information all at once. Therefore, several sessions and revisiting information is important. Everyone is different, so it must be tailored to each person based on lifestyle, self-beliefs and personal circumstances. As mentioned, the right education, tools and supports leads to staying healthy and enhances your well-being and being able to continue your life as normal. If you are at risk of diabetes, newly diagnosed or having issues controlling your diabetes, we at the Diabetes Center have, as well as myself, the diabetes specialist nurse, nurses, specialist doctors, dietitians, podiatrists, as well as an eye screening program, vascular screening and diabetes screening.
As we continue on the Maria Holder Diabetes Radio Show, we want you to listen out for the collaborative program, Your Health, Your Action, a solutions-oriented program hosted by David Ellis that brings together health professionals and people living with NCDs. So make sure you tune in every Wednesday at 8:30 p.m. on this radio station. This is also a good time for me to remind you that once you're a diabetic, you need to get your eyes screened for diabetic retinopathy at the Maria Holder Diabetes Center. You get your eyes checked yet? You need to call this number, 243-EYES Write it down, 243-3937 to make that appointment today. Coming up soon, you will hear patient Tanya talking about how easy and painless the eye screening process is, so you can listen out for that. But right about now, it's about time for some eye music on your favorite health radio show. And you're probably wondering,
What song featuring the eyes will he be playing this morning on VOB?
well, we are going to take you back to 1975. To the music of Frankie Valli and the Four Seasons. After you get your eyes screened at the Maria Holder Diabetes Center, you can do whatever you want with your eyes. Them is your eyes. If you want to take your eyes and go around adoring people, you are welcome to do it. This is the song My Eyes Adored You. Frankie Valli and the Four Seasons, brightening up your Saturday morning.
My eyes adored you. Oh, I never laid a hand on you. My eyes adored you. Like a million miles away from me, you couldn't see how I adored you. So close and yet so far. Carried your books from school, playing make-believe you're married to me. You were 5th grade, I was 6th when we came to be. Walking home every day over Barnacle Bridge and Day, till we grew into me and you went our separate ways. My eyes adored you.
Contact the Barbados Diabetic Eye Screening Program today at 243-EYES, 243-3937 to find out how you get your simple digital eye screening done. The Barbados Diabetic Eye Screening Program.
So close and yet so far. Headed for city lights, climb the ladder up to fortune and fame. Work my fingers to the bone, made myself a name. Funny, I seem to find that no matter how the years unwind, still I reminisce about the girl I miss and the love I left behind. My eyes adored you. Oh, I never laid a hand on you. My eyes adored you. Like a million miles away from me, you couldn't see how I adored you. So close and yet so far. All my life I will remember. How tender we were way back then.
We now welcome to the show a patient of the Maria Holder Diabetes Center, Miss Tanya Gemant. Hi, Tanya.
Hi, Peter.
Tanya, how long have you been living with diabetes?
I have been living with diabetes for approximately, I think, about over 20 years.
And how has it impacted on your lifestyle?
Well, for me, I found out really young. So at first it was really hard to cope with, and with the changes in the body and medication and stuff like that, it could be a bit challenging.
And how did you find it in terms of support from your friends and your family members?
Support was good. When I found out, I wasn't even here in Barbados, I called my mom and I spoke to her. I was scared and she talked me through everything. She said everything was going to be okay. I had a lot of support from my family and my friends. It wasn't an issue, and everybody backed me every process of the way that I was going through dealing with my diabetes.
So you have attended the Maria Holder Diabetes Center. How has that helped you?
That impacted my life very, very, very much. I learned so much from them. I gained so much knowledge on how to treat my diabetes better, how to live better and control my diabetes better, how to eat properly and how, where, when, and not to stress and stuff like that. It impacted my life a whole lot, and I was very grateful for that experience.
How did the advice you got from the Diabetes Center enhance your health?
Well, I was able to change my diet, get better sleep, keep my blood sugars under control, and was able to read up on different types of diabetes. Because when I first went to the Maria Holder Foundation and I found out I was a type 2 diabetic, I was always being treated as a type 1 diabetic. So it was really hard. So the changes were different. Then I had to get accustomed to changing everything in my lifestyle, getting a little bit more exercise, even if it's just walking for 30 minutes a day, eating different, knowing how much to eat and what not to eat. It was a stressful process, but it was very, very helpful.
So did you ever visit the podiatrist at the center?
Yes, I visited the podiatrist, and she talked to me about the care of my toes and my feet and what kind of shoes to wear, how to cut my nails, get my nails cut by a professional. Don't try to cut my nails myself, how to check my toes and my feet regularly, and come to the podiatrist and get regular checkups, and how to manage my feet, because footwear is very, very important. If you don't have correct footwear, you can get a lot of problems. They tell you to check your feet with mirrors, make sure you don't have any blisters, any cuts, because things like that can lead to amputation.
So did you get your eyes screened at the center as well?
I had an eye test, a retinal exam, I think it was, where they put you to look into this machine and they spot a light in the eye and check your eyes. Yes, I had that done, and it was a good experience. It was a bit scary at first, but it was a really good experience. Yes, I did have one.
Did you experience any pain?
No, I didn't feel a thing. It was just the light that was spotted into my eyes, and I was looking at something like a balloon, and they would take different pictures of the retina and the lenses and stuff in your eyes. It didn't hurt at all.
So what advice would you have for other diabetics on how to manage the condition?
I know living with diabetes can be hard, and I wouldn't expect people to just go and just say, well, yeah, I got to do this. It's a process. You have to take it day by day. You got to learn how to and how not to, the goods, the bads, and the don't. You got to learn how to manage your medication and how to take your medication, because sometimes we take medication after we eat and the blood sugar is still high. You got to know how to maintain those correct levels. You got to know how to eat your correct diet, how much fruits you can, because fruits are good, yes, but fruits are bad. Can maintain your vegetables. Do not stress, get good sleep. But it is a working process, and all of us can get through it to a point where we can have those low blood sugars without having any problems. But it is a process. It takes longer for some of us it doesn't. But it is very hard, and I would advise them to get regular checkups, see your podiatrist, see your nutritionist, and see your doctor, because sometimes dealing with this, especially with your doctor, medication needs to be regulated at times, because sometimes it might not give us we might not get the correct dosages to lower blood sugars. Sometimes we might have it makes it too low. So that's why it's always good to see your physician to make sure everything is okay, and always monitor yourself. Always take regular blood sugar testing. And I would advise every single diabetic to go to the Maria Holder Foundation. They were the ones for me, Tanya, who advised me and who took care of me. Everyone is there. Everyone you can think of. You have the nutritionist, psychiatrist, doctors, nurses, everyone, diabetic nurses. You get everything done there, and it was able for me to get my blood sugars under control. There is no one or no place better in Barbados that you can go to than the Maria Holder Foundation.
The Maria Holder Diabetes Center, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. And very soon, there will be a dedicated vascular department added that will be the centerpiece of a new national preventative campaign that will highlight the discovery of early circulatory problems in the limbs and extremities of at-risk persons. So if you are diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened. You can reach them by calling 417-0305 or 243-3937 to make that appointment. The last 15 minutes you heard on your radio was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Until next time, take care of your eyes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.